Light for the World, simply referring to giving sight to the blind, is the program that commenced in 2010 in partnership with Ministry of Health to counter sight challenges. Since then, around 250,000 children have been screened in schools and at least 29,000 spectacles provided. Teachers in primary, secondary schools and tertiary institutions have received training to detect eye problems earlier in children.
And I think nowadays, as we are looking at telephones, at tablets, at computers and others, sometimes you may find it becoming more obvious who has a sight problem or not. And I think hopefully also our program and also special needs education in Uganda has hopefully helped that teachers earlier today recognize that a child who is squeezing the eyes, who is making funny faces, where maybe a few years ago a teacher would have said you are not behaving well and you have to go behind. It's now rather to say maybe you have a sight problem.
Handing over the project, Mr. Wolfgang Gindofa, the outgoing program director, said eye problems affects one's health and productivity. Only the well-to-do could afford getting refractive error.
High quality, affordable service delivery for eye care, especially for spectacles. This was our main domain, and this is what we hand over today.
If there's a child or girl in a rural community and is following in class and cannot read what the teacher is writing on the blackboard and is maybe too shy to admit that she cannot read or gets headache, cannot concentrate, it has an immediate impact on her education.
To hasten services, the program also trained 74 ophthalmic clinical officers from all over the country to increase on the number of refractionists.
Eye health plan, which eventually got over, and we developed the fourth, and refractive errors are a strong component of those eye health strategic plans. So all this we are talking about is contributing to that plan.
Usually, getting quality spectacles requires one to have between 500,000 to 1 million shillings. Medical Superintendent in Tebe Hospital, Dr. Moses Muwanga, says this will no longer be an issue. A public-private partnership has been introduced for people of all age groups. Pay only 50,000 shillings for all services.
My role today is really appreciate the winning team. We did the local part of ensuring that your vision, your planning matures. I'm sure if it wasn't my team, despite that it may not be recognized because there was a lot of money which came in, a lot of ideas, a lot of planning, but I'm sure if the local team fails, it can sabotage the whole system.
The National Optical Workshop is being housed at Entebbe General Referral Hospital. Mutonyi Hilda, UBC.